Hi, I'm Dr. Satish Kumar, and this is Kaizen Dental. Our aim here is to help dentists succeed. Today, we are going to talk about MPH in the US after BDS in India. And for that, we have with us Dr. Akshata. After completing her BDS from India, she moved to New York, where she did her MPH from the New York University. She had a concentration on healthcare management during her MPH. She is currently working as an associate director with the New York Health Plus Hospital, which is the largest public health system in the US. Hi, Dr. Akshata. Thank you for taking the time and joining us in the session. My first question to you is you did MPH in US. How long was the entire process and what all did you learn during it?
Thank you, Dr. Satish. So MPH, the program itself was about 2 years, I would say 18 months, 4 semesters. Um, every semester has 4 to 5 courses in it, depending on your program. Um, so it's usually divided between credits. So first, I did my MPH from NYU, so we had um, 12 credits each semester. So that divided into 4. It took us about 18 months. Second question was, what did I learn?
Yes. What did you learn in the process? Course.
In the course, so we had my concentration in MPH was healthcare management and policy. So the courses involved were a lot in strategic planning, healthcare management. NYU has another management school, so many of my classes were in that school and with the students from that school and the professors in the management school. So the management courses were one part. We also had some epidemiology and biostatistics, which are core courses that everyone has to take. And then we also had microeconomics and public health biology and some of those smaller credit courses. But yes, the bulk of it
Understood.
was healthcare management and strategic planning
Understood.
around.
So, how did you go about entering into this course? What is the entire process to get into MPH?
So firstly, you need to know if you want to do MPH. Once you're sure about, okay, you want to get into masters in public health, there are a set number of concentrations. So we have epidemiology, biostatistics, healthcare management, healthcare policy, environmental. Depending on your school, there are these different courses, and depending on what your interest lies in, you pick those concentrations and see which colleges are known for those concentrations. Research your colleges, and then there's one centralized application portal called SOPHAS, SOPHAS. That's where you apply. You can start. You can create an account and see what the requirements are before even applying. Opening an account is free, but then application costs. For the application, one needs to have the Tofel scores. GRE is not required by many schools. And now after the pandemic, many schools have even waived that requirement altogether. Many schools just have the requirement, but they don't look at the scores. So I wouldn't worry too much if you don't have a GRE. I would just go ahead and apply to schools that don't require a GRE. But yes, TOEFL, I think everyone requires TOEFL either now or later. So that's that. Then also have a resume ready. SOPHAS has fields to enter. So your education experience, they have fields and specific areas where you can input all of that. So have that resume ready. So it's easy to fill that because the application is pretty long. It goes over pages. So having all that material together before you start the application is important. The deadlines for each colleges are different. So have a Excel spreadsheet with each college of your choice and the deadline associated to it, so you're in time to be able to apply. The statement of purpose is also important. So better to have that proofread by other colleagues and other teachers maybe. The statement of purpose is actually very important, that many times decides whether you get accepted, whether they offer you scholarship. The SOP really matters because that's kind of the interview of the person without really having an interview. That's really how you can talk to the admissions committee. So I would say spend a lot of time on your statement of purpose. We're not, as Indians, used to writing statement of purpose, but in the US, it's pretty common. Even to buy a house, sometimes you need a statement of purpose.
Oh,
So it doesn't leave you even when you grow older. So you just have to develop that skill about not really bragging about yourself, but to be able to be comfortable to talk about yourself and your achievements. It's pretty common here, and you have to speak up for yourself. So putting that to paper is very important without feeling uncomfortable. So that would be, I think, the SOPs where people need to focus on. And then after you apply for through the SOFA's website, some colleges also have their own portal to get into and apply. So that could be a small fee. Other than that, not all colleges do that, and it could have changed since the time I applied. But making sure there's no supplemental application there for your college is also important, because if you don't complete the entire process, your application is not going anywhere. So yeah,
so
they could ask.
basically, you need SOFAs, you need to have your SOPs, your resume, GRE
Yeah,
maybe, TOEFL compulsory.
yeah.
Yes.
Yeah,
And
TOEFL also, I think with the pandemic, some schools are not having that as a requirement to apply. Maybe you'll need it if you get accepted, you need the scores, but I think they're being a little lenient considering the fewer dates available. And, I think some colleges are being understanding about it, but that's really
understood.
dependent on each college. So better to do your research, know what the requirements are, have the materials ready, and then get into SOFAs to sit and apply.
Understood. So is there any minimum score required for GRE and TOEFL of that sorts?
Um, GRE, no, not for MPH. I don't think many colleges even look at the score. I think they just need the requirement. But yes, some colleges do need. So if there are two applicants who are equally good, but one person's GRE score is higher, they may choose that. But we don't know what the admissions committee looks at, at each of the colleges. So better to have a high score. I didn't have a high score. I just had a very average score, and I didn't want to take it again. So I applied with whatever I had. So maybe not Ivy Leagues. Ivy League schools do require a good GRE score, but like every other, like if it's not a Ivy League, if it's even if it's a good college, but it's not an Ivy League, I think there's no minimum score. But TOEFL, I think anything above 100 is considered a good score, and I think that should be aimed for. And I think Indians are pretty good at English, and getting over 100 is not a big deal.
Okay. And what about GRE? I've heard in GRE there is maths. Is it easy clearing that?
It's so yes, it gets depending on how far how much time has passed since you've completed your 12th. It can get a little harder to get back to it, but it's to me it was, I like math, so I had fun going back to it. But yeah, it could be a little bit of a strain because you've been away, so I wouldn't call it difficult. It's just getting back to that memory of math. You may need some help. I didn't join any class, but I took help from my friends who are good at math and uh, who are still in touch with math. So yeah, I think some help in GRE would be helpful. It's really hard to remember some of the formulas.
Understood. So you are even told there is a requirement of a resume. How do you make your resume stand out in the application process? Before you listen to the answer to that question, if you're liking this video, please do not forget to hit the like button below. And if you enjoy the content we keep on coming up with here, do not forget to subscribe, because we will keep on coming up with such content to take your career to the next level after BDS.
Sure. So resume in the US are very different than in India. For application, I think you may have to attach it, but SOFAs has fields for each of the areas. So if there's an education, then they'll have fields of, and they'll prompt you with questions. So having a resume with you is nice, where you have all the information ready, so you can just copy paste when you're applying on the actual platform. The things to highlight for application to MPH, because it's public health, your community service becomes most important. So I would highlight that above work experience, and then go on to having work experience. If some people do their MDS in India and then apply for MPH, I think that's very, very good to highlight if they have MDS, because I've known people who have an MDS get more scholarship than people who don't have a master's from India. So it really depends from college to college in your own application. But community service, if you have more education than the other applicants, I would highlight that. Work experience, yes. Many people say publications are important to have. If you have any papers published, to include those. I have not heard from people here that that matters for MPH. Maybe for BDS, it matters because they are more professional courses. But for MPH, I've not known anybody like getting preference because of publication. So don't worry. I've known
Understood.
people. I've known BDS folks trying to rush to get publications and getting their names on like third, fourth authors. I don't think that helps anybody, at least not for MPH. But yeah, of course, if you have it, then please highlight those. But I would say public health experience, community experience is most important.
Understood. You were talking about scholarships, so I want to know two things. What is the approximate fees in most of these MPH courses, and are scholarships available? And how do you go about applying for them?
Sure, very loaded question. So, um, uh, so colleges in the East and the West Coast and your Ivy Leagues are going to be more expensive than some of the other colleges. So colleges in the middle, I like Texas and stuff, Texas and all, they're good colleges, but they're not probably as expensive as the colleges in the East and West Coast. I can only speak about NYU because I went there. So when I was studying, I think the cost per credit, all the tuition cost over here is per credit, and then it gets added later on because they can't give you a cumulative fee for the year because there's fees and there's health insurance and all those things added. So per credit, it was up $1,600 to $1,700 for me,
Okay.
and it was a 46 credit course. So about $80,000, I would say, and that comes out to 60 lakhs. Okay, because I took my loan for 60 lakhs. So about
Understood.
60 lakhs, you would say it was just be tuition and probably health insurance. Health insurance in New York is way more expensive than other places. So that would also add on to that. And then living is different based upon your city. Living in New York is much more expensive. So you'd also incorporate that in addition. And for scholarships, yes, scholarships are available, maybe not as much. And that doesn't have to do anything with MPH. It just has to do with the school, how much funding they have and how much they want to spend on that particular program. If NYU's MPH program was newer, so they had a lot of funds to provide scholarship to students. So when I applied, they were giving out scholarships proactively. So when we applied, when we got the acceptance, many people got, not all, many people got a scholarship. I don't remember how much I got, but I know my friend who had an MDS got a little more scholarship than I did, and somebody else like didn't get it all. So it's not like everybody got scholarship. So those are the two. There are two types of scholarships. Either when you get accepted, you get a scholarship proactively depending on the school's funds. And the second type of scholarship is when you get accepted, they send you a list of scholarships or like direct you to somewhere on the website where they have sources. So there are many donors, or they have already set scholarships for people where you need to apply. So they might have their own criteria, maybe an SOP, why you deserve that scholarship. So see what fits your criteria. Sometimes they have scholarship for just indigenous people, or sometimes people coming from certain countries or coming from certain backgrounds, or just women. So see what fits in your criteria. There's some scholarships in India also. I had applied for a couple. There's Tata scholarship. There is RD Setna. I got RD Setna scholarship. It wasn't much, but it still took care of
Just
my one
adds
month.
on.
Yeah, it took care of my 1 month's expense. It could have been possible, like it would have been fine if I didn't get it also, but it just helps you, it helps you knowing that, okay, you have 1 month's expense to go about. So yeah, those are the couple of options. There are many scholarships in India also. Actually, people should leverage those. Maybe there is more now since I've studied.
Understood. So now that you've told getting into the entire program, how was the program? How was your experience? How's the education system out there? Is it different? Is it similar to India? How did you find it there?
I loved it personally. I loved the whole experience. The studying part, the academics of it, I wouldn't call MPH very difficult, but I'm not going to say it's very easy either. You're going to feel your midterms, you're going to feel your final exams. So there's a lot of studying involved, MPH related. So you have to give it your all, otherwise your grades are going to drop. It's hard to keep up straight A's throughout. But I wouldn't call it difficult. If you do if you prepare well, if you study for your exams, it's going to be fine. Studying is a little different. You don't have to mug up things. It's very multiple choice, but multiple choice also means that you have to know all the matter. The courses are credit based. So you need to know next semester what classes are you taking, and you have to apply soon because everybody wants those classes. and they get full pretty fast. So apart from the compulsory courses, if you want to get like the elective ones, you have to be on top of your game. So you need to know what classes you want. You need to know which professor. So a little bit of research. It's not like very set timetable like India. Okay, you have a timetable, you attend this class at this time. It's you are paying for the program. You need to know what's best for you. You need to make most of it. They also send out the syllabus before you're applying, you're enrolling into the class, not applying, enrolling into the class. So you can go through the syllabus, you can find out what teacher, they have ratings for the teacher. And each class is, sometimes you have different professors teaching the same class. So you can go back to previous semesters reviews and see which teacher is better than the other, talk to seniors. So you have to do a little bit of your own homework to make the experience better for yourself. Networking is also important. You need to network with your professors in the class, after the class. Ask questions. No one's going to come to you and explain things to you. So even after your exam, ask questions. I think asking questions is something I did a lot more here.
So basically, you need to be proactive in identifying what all you want to learn and in networking. So proactive is the key word here, basically.
In summary, yes, you actually, you couldn't have spoken it better than I did. Yes, being proactive, you need to know what you're doing. You can't just go with the tide and finish your MPH. Then it's just you won't even know when it's over, because 2 years pass very fast. By the time you get used to everything, so you have to be very prepared even when you come. That's what helped me. Maybe it doesn't for other people, but I think, being proactive is key.
Understood.
If you want to get more of your experience.
Now you have told me about how to get into MPH. Now the funny question which everyone asks, what after? After MPH, what? Are there enough jobs in it? And how do you go about finding those jobs?
Very good question. So, yes, I want to say yes, there are plenty jobs in the US. The job market in the US now is just growing with the pandemic, especially in public health. Healthcare needs people. There are jobs. If you have STEM, then it gets, if you have STEM, which is like you get 3 years of work visa pretty much to work, and you don't have to be dependent on an H1B. It's easier to find a job because then the employer is more willing also to give you a job. So you go about finding those a little faster than you would for H1B jobs. I have found.
So I just want one question here. MPH has both STEM and non-STEM as well.
Yes. So MPH, it depends on your school. Most MPH in epidemiology and biostats are STEM. Everything else is not. So if like my program, MPH in healthcare management, is not STEM in most colleges, but NYU, for NYU, entire STEM, the entire STEM and entire MPH program is STEM. So it doesn't matter what concentration you take, it's STEM. But for some other colleges, only epidemiology and biostatistics would be STEM, and everything else like environmental management is going to be non-STEM.
So non-STEM, really, basically you have 1 year. And if you have a STEM, you have 3 years.
3 years in total, 1 plus 2 years, yes.
Understood. So finding such kind of MPH courses which has a STEM backing is advantageous.
Yes, definitely. It's better to get into a STEM program. So when you're doing your college research to apply, you can also divide those into STEM and non-STEM. That's how I picked MPH over MHA, because MHA and MPH were very similar courses. They were both healthcare administration and management, but MHA wasn't giving a STEM. MPH, some programs were giving a STEM, so I picked MPH over.
Understood.
MHA. And MPH is also a little broader. You can learn courses and you can kind of make your course in such a way to be more desirable after graduating for a job. MHA is very dry and healthcare administration only, so you can't expand. I like to be a little more broad when you're searching for a job, so you can fit into any kind of job profile. So yeah, to search for jobs, networking is also very important. So your professors are very connected, very well connected. They're much older, much more experienced. So they often have projects going on outside of school. So they have connections and they can either get you an internship and that can turn into a job. So networking is very important. Even networking with your seniors and peers, because if they are working in a company and there's a position, they can
recommend you.
Yeah. networking is a big deal. Of course, that doesn't guarantee a job, but that could guarantee an interview. And then even getting an interview is a big deal. Excuse me. Even getting an interview is a big deal sometimes, because your resume cannot get highlighted in 100 in a pool of 100 applicants. So a recommendation definitely helps. So yeah, and what was your other question? That I would say that is networking and applying for jobs online are the two ways that I applied.
Understood. So you were talking about H1B visas. Okay. So is it easy to get it after your job?
I don't want to say it's impossible, but it could be a little difficult. I think H1B visas are difficult for across all backgrounds, but it could be a little more difficult for MPH opposed to IT people, folks from IT, because that's a field more in demand. But now with the pandemic, health IT is very much in demand. So I would say people with MPH from epidemiology or biostatistics, or even if you have any other concentration and if you have skills, technical skills, like if you've taken some coding language, maybe you know SQL. I think it's called SQL or Python. If you know any of these skills, and they also teach stata in biostatistics in schools. So if you can excel in those and get some kind of a certification or just have experience in it, no need for even a certification. And if you can fit into health IT roles, I think that would give you a better chance of getting H1B visas, in my opinion, rather than
Understood.
other programs.
What is the average salary one can expect after graduating from MPH?
So when I graduated, the average salary that I kept hearing was $60,000 annually. That was the average salary. Of course, it's more or it's less. Starting off, it's not going to be $100,000. It's going to be a little less, maybe $70,000, $80,000, depending on where you're working. Whether it's a non-profit, because MPH jobs, many of them are in non-profit. So non-profits have a lower salary scale than for profits. But maybe a couple of years into it, it can go up to 100,000. I think generally speaking, I think the salary scale is a little lower than IT jobs, slightly lower, but
Understood.
time.
Understood. Now that you've gone through the entire route, you're doing well. My question is, if someone wants to emulate what you have done and is going this route, what would be your advice to them?
They need to be sure that they want to do MPH. That would be my only advice, because we come from a clinical background. Many people get into dentistry without knowing that they want to do dentistry, or they do dentistry because they love it and they're doing well for themselves in the clinical field, but then they choose MPH as a stepping stone to DDS, which is great. But as long as they know what they are doing and what they are getting into, is really important to be clear of what you're getting into. Courses are expensive, whether it's MPH or DDS. DDS is way more expensive than MPH. So being clear of what you're putting into financially and what you're going to get out of it and the time that you're going to take is very important. I've known people who take MPH, but then their mind is to do DDS. But then by the time they graduate, neither have they excelled at doing their MPH and actively search for jobs, nor have they completed their NBDs, because you just didn't get time to study or do well in those. So you're like not in one place. Mind is divided. After graduation, you don't know what you're doing. So like I said before, if your legs are in two boats, you're going to drown. So you need to know what you're getting into. Are you sure you want to do MPH? Do you enjoy getting into clinical, into non-clinical field of work? Is that what you prefer? So yeah, I would say know what you're getting into. Don't listen to others.
I think this is a very apt advice, because a lot of people look into it and just say, I want to go abroad somehow and I'll do whatever it gets to get there. But then they realize they really do not enjoy what they're doing. So your advice, I think, hits the bullseye, where they need to know what they're getting into and then take a call.
Yeah. And I would also suggest, when they talk to seniors, say if somebody comes to me, I tell them what my day looks like, because many times you don't know. Studying is one thing, but when you graduate and you start working, that's how your life is going to look like every single day of your life. So if you don't like sitting on a desk every single day, it's not going to work out for you. You're going to get bored. I love sitting on a desk. I don't like to see patients every day. I don't want to meet new people every day. So I'm fine with that. But other people may not like this. So know what your day-to-day is going to look like and what your work is going to be involved in. If some people really miss working on patients and providing treatment to them, so they don't feel happy when they are doing MPH work. So
Understood.
knowing yourself is really important here.
Thank you, Dr. Akshata. It has been a very amazing session. You've told us about the entire process and things they need to look out for. Thanks a lot for your time.
Of course, my pleasure. Thank you for having me.
Thank you.